For the attention of Floresville EMS. Floresville EMS needs you to make location to Connally Memorial Parking Lot. Connally Memorial Parking Lot for a mock stroke drill. Wilson County Sheriff's Office, KVS 685, time is 11:11. So EMS Medic 7 County? 7, go ahead.
Show us call received and en route to Connally.
So they have gotten the patient en route to Connally. Now the next process is they're going to call our phone so the nurse can take a report and they're going to alert us as a stroke alert. So we would call that. Our next step is call it overhead and get all resources. That includes lab, CT, radiology tech, respiratory therapist, and the nurses and the physician on board to be here when they roll in.
Can I ask a question?
Yes.
You live very, very close to the hospital. Would it be better just to call 911 and tell them that you're on the way coming yourself rather than go through anything else, having somebody pick you up? I mean, like many of us live very in proximity to the hospital.
As long as you're not driving, I'm happy with that.
Okay. Getting all this information ahead of time, though, by having us.
This would be if they come through by EMS. Now, we do have people, family members, that bring them in their car.
Which would you prefer? I guess that's what it was.
We take it, doesn't make any
As
difference. As long as you're
Stroke, as a neurologist, I prefer EMS unless you live across the street. You show multiple times, when you show up in an ambulance, you get a little bit quicker attention. Where this is a smaller place, so it would work.
I do live across the street. I mean,
you prefer somebody like a little general way, we do lean towards EMS, but if you live
that's what I
that.
wanted to know, because I'm hearing all this information y'all are getting from them, and
Because
that
as we
helps
set up
y'all.
the system, as you can see, we've kind of got it all lined up.
So, ma'am, just to speak to that, sometimes I've seen patients and families make very bad decisions about trying to drive on their own. Patients who are having stroke-like symptoms are at risk for having heart dysrhythmias that can develop. So the safest bet is always call 911, even if you're right across the street. What's going to happen if your loved one is driving and you slump over and stop breathing, and then they get distracted and have a wreck right in front of the hospital?
Exactly.
I've had patients that have chosen to drive their children who are not breathing from home rather than call EMS because they thought they were close enough. Bad decisions. So we have I've found a very responsive EMS system. So the message that I would send, if you have any place to take it back to with your wherever you work or your community or your neighbors, call 911. Our system has been very responsive, and it's still the safest bet because you've got folks that have more things to give you rather than just you're stuck on the side of the road sometimes or you're not working right. So that would be, even if you live right across the street.
That's what I'm wondering. You
I
can
really
look out the
think.
window and see my house.
But you never know if there's going to be some kind of obstacle, then you got to turn around.
That was
EMS
the
has got
thought
to try
that I
to
was
find
having
you.
when I'm hearing y'all
The
getting all this
safest bet.
information.
EMS knows when there's a roadblock or a road's out because the county is already aware of it. So the safest thing is still call 911 if you have the ability to do so.
That's good. That's a good message.
Yes, ma'am.
That's all we want.
So right now the ambulance is calling report to the nurse and giving them all of that information on the patient, the vital signs, the time the symptoms started, any medical history, allergies, anything we would need to know right away to treat the patient. And they should be here right around the corner.
Seven, go ahead.
Best you can show us en route to Connally, transferring one patient.
4.
That's absolutely right. I was thinking of this too. When we get the calls, And on a very busy day, I could have every one of these rooms filled. If I know that EMS has already identified someone that's in need, we can try to either call for help from upstairs. Sometimes we can borrow nurses from upstairs if we need to, or at least get ourselves ready. All right, sometimes I've actually got folks in my this is our main trauma and acute care room. Sometimes we've already got somebody there. They're stable, and we can work on getting the room prepared. Every single person that plays a part in dealing with strokes is alerted when we know that we've got a potential stroke coming in. The pharmacists play an important job. Our lab techs play an important job. Our lab personnel, just in general, we've got machines, every single little part. CTs, what if we've got a CT scan that's happening right this minute? We've got to be ready. I have been extraordinarily happy. One of the most important things we need to know with possible stroke is it a stroke that's from bleeding in the brain or a stroke from blockage in the brain? We have to get somebody from the CAT scan, from the door to the CAT scan, for me to make a decision if I need a neurologist or not. And our response time here has been just amazing, getting the stroke seamless together. I can usually get a result with a radiologist from Methodist telling me the result within less than 5 to 10 minutes of getting my scan, which is we're meeting milestones nationwide. Working at centers that are larger, I don't find that I get the same amount of door to CT time because there's so much going on. So here we've really been hitting a really good response time. It's phenomenal.
Now they have a real call that the other patient's coming. They're going on a real one.
For everybody here.
Or 4.
Patient, another patient.
This is the stroke one. This is not the real patient.
Oh, okay, that's good. I was This is that? Yes.
This is our actual patient or our stroke patient. This is the mock.
They're leaving to go on the other call. And the fruit truck.
Now, y'all would be lined up right here? See who the actor
Hello, ma'am. Dr. Frazier. What I'm usually looking for there is if someone can breathe and talk right. It gives you a lot of information just to come on in. Oh, wow.
Jessica is one of our charge nurses, and she's going to be helping do assessment on the patient.
What's family?
All right, just gonna take a look. Okay, 68-year-old female. We have a IV over here in the right arm. She's got left-sided weakness, facial droop, up in the lower extremities, alert speech, onset of symptoms right about 20 minutes ago. She's acute. She's had no relief of symptoms.
Okay.
96% room air. She is 100% on 3 years. That's what we had her on. She's doing blood pressure at 204/100, 122 pulse, 18 respirations. No allergies that I'm aware of. unknown medications and history of them.
Appreciate it. Anything else?
No, ma'am.
So at this point, I would do a rapid assessment for stroke symptoms. There's a few signs you can find early on. I try to limit actually waiting to get IVs in, waiting to get cardiac things. Usually the EMS folks, they've already got some monitor information for me so I can assess for cardiac problems. But I can get a quick face, arms and legs, and if there's obvious signs of stroke and no obvious quick signs of trauma, which is something that people working in trauma centers you look for pretty early. Either way, try to get the patient to the CAT scanner right away. So that would be.
So she would decide right now to go ahead and do a stroke alert based on the patient's symptoms. At that point in time, we would page overhead stroke alert, so we could go ahead and announce to everybody else in the other ancillary departments that we need them to come get her straight for CT, because that's the most important thing right now. Cindy?
Normally what I would do is just this. Cindy, can you call stroke alert, please? And she responds just like that, and I know it sounds a little crass, but it works really well.
Communication is key.
Well, and that's also the benefit, some in a smaller place. I'm right here, like a few feet away from my phone call. I usually, if I'm able and I don't have somebody else that's critically ill, I like to go with my patient down to get the CAT scan. I can look enough that if I see bleeding that's very obvious, I know that I've got a completely different problem and a different specialist that I'll need to talk to. So far we haven't used the system, or I haven't used the system for a head bleed, which is a different type of problem. But so I'll go down with the patients, and by the time I am walking back with the patient from getting the CAT scan, and the CAT scan part, are we gonna demonstrate walking?
No.
Okay.
They're right there.
It happens so quickly. So you can remember, we're doing demonstrations. So what I've got a patient that needs a quick head CT non-contrast looking for stroke. You already know, thank you for responding so quickly. And then usually a lot more folks show up. I think they're probably afraid to just bust through the room. We've got personnel here from lab. By the time I come back from getting the CAT scan done, the phones usually ring in that the radiologist is able to look at it. So the system's been very nice.
This is Nancy. She's registering the patient on the back end. EMS gives her all of the information so we can get them registered at the same time while we're doing our part. Lab would now get the blood. One of the other important things is to get a blood sugar, because sometimes that can alter a patient's mental status and possibly mimic stroke-like symptoms. So before we call the neurologist and get all that set up, we want to have their vital signs and an AccuCheck also.
EMS. So if the, can I talk more then? So radiology's called me and they said that I have no signs of bleeding. Usually the results, if you're early in a stroke, you may not see anything. They'll read the head CT as a normal scan. It may take a number of hours before signs of obvious damage to the brain that is indicative of a block show up. So once I get the report from the radiologist, then I ask Cindy again to please go ahead and contact Methodist so that we can talk to the neurologist, and we wheel the robot over. She gets them on the phone. We're actually going to do that. So, okay.
Yeah. So behind scenes, so we're not walking back and forth, Cindy, our clerk, is actually putting all the information to Stroke Respond. So that's something that the neurologist is going to be able to pull up and look at the vital signs and all the information, as well as the CAT scan on the patient. So he can actually see and read the CAT scan himself.
20 minutes.
30 minutes?
20.
While she's doing that, we're getting a consent for the patient to use the Tele-Stroke system. And at that point in time, after she signs that, we'll get the robot in front of her and get that started.
Okay. So I need to get your permission in order to use the telehealth. It's the computer screen we're going to put at the front of the bed so the neurologist can evaluate you. I just need to make sure that it's okay that since Dr. Frazier is recommending this, that it's okay with you to go ahead and do that. Okay. And so I would have her sign if she's able to sign. If not, we would find a family member to sign for her.
Okay.
What if there's not any family member?
If there's not any family member, usual protocols that first, we've got other situations where patients need to give some sort of documentation. Normally I'll bring a number of staff members to sign witness if the patient's able to communicate at all, and we can witness. Sometimes they can nod if they can't speak. But there's other ways that we can document, and you just have several different people document together as witnesses behind my signature.
Is there a lot of it that live alone?
Yes, ma'am?
We usually have a well.
Ma'am?
What's the question?
Well, I said they used to have wells.
Well, if you're lucky, but patients don't roll in with us, so we don't know. Yeah.
This is Sam.
This is Sam.
So at this point, I've talked to neurology or no?
You've gotten a radiology report.
Okay. So at this point, after Cindy's typed in to the system, usually I'll get a call within a couple minutes after I've made that request. And I can say usually because I've already done this a few times. And so my experience has been, again, very rewarding. I'll have a quick conversation with the neurologist, explain what I've seen, the onset of symptoms, answer any specific questions they have. And so far the time has truly been, all right, do you want me to hang up now? Yes, I'm logging in. And I walk from my phone and in here, and I've got a neurologist talking to the patient. It's phenomenal.
So as Cindy is putting all the information in stroke response, she's called the Methodist telehealth or Methodist one-call number. So that allows not only the neurologist to be on here, but the transfer center. So while the doctor is talking to the neurologist, the transfer center is on there and has a bed for us immediately. There's no waiting for a bed. If they do not have an ICU bed right away, then they accept the patient in the emergency room. So we do not have to wait for any transfer process. It's an immediate acceptance if we need to transfer the patient. And you'll be able to see them on the screen as soon as they come up.